Today, we want to welcome to our Mental Health Awareness Month webinars, Dr. Heather Brathwaite. She has been a psychiatric mental health nurse practitioner in Florida since 1991. She is board certified as a psychiatric mental health nurse practitioner. She has received her BSN from FIU, Florida International University, and her MSN nurse practitioner in 1996. She continued and obtained her doctorate in nursing from Barry University in 2016. As a nurse practitioner, she has many years of experience treating patients in both inpatient and outpatient throughout the lifespan and across practice settings. She brings a humanistic philosophy of holistic care for both mind and body, and an abiding commitment to individualized, personalized, comprehensive care for patients. Dr. Brathwaite is one of our full-time nursing faculties at Miami-Dade College School of Nursing. She is my colleague. We're very happy to have her with us. She has a stellar experience and is someone that I have admired and looked up to, and actually followed her footsteps since I remember meeting her way back at FIU where she was teaching in the year 2000. So welcome, Dr. Heather Brathwaite, and she's going to speak to us on depression and finding joy and happiness.
Hi, good afternoon, everyone. Very happy day to everybody. This is about being happy and not feeling depressed and sad. And thank you, Dr. Carrie Dade, for that introduction. So I know that our time is limited, and I want to try to get as much in as possible. But I didn't have a slide PowerPoint presentation because I think there's something called death by PowerPoint, and I can pretty much articulate what I need to say and have it be interactive and have you guys answer questions at the end. So for that reason, I'm not doing any PowerPoints. I'm going to speak to depression, and then at the end, I have a couple of points to share with you as to how you can. If you don't already have a little bit of joy, how you can be happier by doing a simple set of things every day, or not if every day. Make sure you get some of this stuff in. So we've heard a lot about depression, but what is depression? Depression is very common. It's a serious medical illness, mental illness that can affect how you as an individual feel, how you think, and how you act. And the good thing about it is, fortunately, it is treatable, but we have to be able to catch the depression in the early stages. And I think we have a good chance for folks to recover fully if we catch this depression early. So how do you know that you are depressed, or how can you sense if someone in your life is depressed? There are several symptoms, and I'm just going to mention a few. We have half an hour, and I'm going to try to talk fast. But someone is feeling sad, or that the mood has gone from being happy, very chirpy, like me, bubbly, happy to be here. All of a sudden, that goes away. You used to take pleasure in things, and you no longer enjoy that. That is called anhedonia, ANHEDONIA. So let's say, for instance, an example of that is you, for all the young ladies on the call, all the ladies on the call, especially the younger people, because I don't have anything to do with my nails. I just use them to cut plastic. So you used to get your nails done. Every time we see you, you got the pink, you got the white, you got the this, you got the that. All of a sudden now your nails look like funky. Oh, and we ask you, well, what's up with the color this week? And you're like, I'm like, okay, I'm going to keep an eye on you. You start losing weight. We notice that you've gone from, you know that when you don't usually see weight loss unless it's about 20 to 30 pounds. So you ask them, so wait a minute, you look a little thin in the face. That's the first place you can see the weight, at least for me. That's the first place people notice. And they're like, oh, Heather, what's going on? I said, oh, well, I'm on a weight. I'm doing this dieting. Okay, so that's good. So you would expect that I would be losing weight because I told you, but I am not doing anything. And the weight's just coming off. Red flag. Or you gain weight. You can lose weight or you can gain weight. You have trouble sleeping at night. So I see you with your eyes red. You know, people have bags under their eyes. You notice something about their face change. They're not sleeping. Well, are you sleeping at night? No, I don't know. I have difficulty falling asleep and I get up in the middle of the night 2 or 3 times. You look fatigued. You ask them if you look like you're dragging. There's no energy to you. There's no oomph to you. There's no get up and go, put the foot on the throttle kind of thing. Nothing there. You lose energy. You look fatigued. You once went to the gym 3 times a week. You no longer go into the gym. You tell people, I just feel blah. So when I ask you, can you tell me about this blah feeling? Um, there's nothing to live for anymore. I just don't want to be here. These are the subtle things you hear. When you hear those kind of comments, you take it, that's the one you got to take to another level. Not wanting to be around, not caring, feel that there's nothing to live for. These are all signs. Difficulty concentrating. You're talking to them, they're way out in left field. You can't, hello, hi, come back. You have to do that to some people sometimes. And guess what? They're like, you have a clue. So those are the thoughts. You have people that will tell you again, feeling helpless, feeling hopeless, there's nothing to live for. Then we start hearing thoughts of death or suicide. We don't want the depression to get to that point. We want to be able to capture or catch the individual and snatch the individual when they're just having the symptoms of depression. Now, these symptoms can last anywhere from a couple of days to a couple of weeks. And if they present and the presentation of the symptoms cause a major dysfunction in their ability to care for themselves or care for family, to do their work, they stop going to school, then is when we look to the professionals, the licensed individuals for help. Remember now, keeping in mind with our nursing students and all the persons on the call, some medical conditions can max I am thinking a lot of stuff like thyroid problems. If you have a brain tumor or vitamin deficiency, sometimes these medical issues can cause depression and can cause you to feel sluggish, slow. So what we would do usually, we would do a medical workup or refer you to a medical provider who would give us a yes or no, everything's good with the thyroid. They do a scan, there's no brain tumor. They do a vitamin panel, there's no deficiency. And then these symptoms, these medical problems can cause symptoms that mimic depression. So it's important to rule out the general medical issue. Now, how is depression different from sadness or grief or bereavement? Now, we're in a time of COVID, and it has brought some significant changes to our lives, believe it or not. For the last year, everyone has been impacted negatively, I would say, because of the COVID virus and what it has done to our loved ones. We've seen death. We've seen people that end up with really severe medical challenges that would bring about sadness. The death of a loved one, the loss of a job, the ending of a relationship are really pretty much difficult experiences for anyone to go through or endure. And you have normal feelings of sadness or grief. And your response to these situations are somewhat different. Being sad is not the same as having depression. We all get sad. Like I said, those are some of the things that make us sad. The grieving process is a process that is natural and unique to everyone. Sometimes we get in practice where someone would come in and say they're grieving because their mother died or their father died. And you ask them, when was the death? So in your mind, you as a provider sitting on the other side, you're thinking that the death was maybe like a couple of weeks ago, a month ago, and they tell you, oh, he died in 1999. And then you like jump back in the chair. It's like, okay, so you don't open your mouth, you don't say anything, because people grieve differently. And we say in psychiatry, things are cyclic, or things come around in cycles. So we have the individuals who have bipolar disorder that cycle every year. You can pretty much pinpoint when they're going to come in because they cycle. And the same thing is with people who are grieving as a result of death. Around the anniversary of the person's death, they become sad, and we know we need to address that, and psychotherapy is what really helps these individuals. In grief, painful feelings come in waves, often intermixed with positive memories of the deceased. In major depression, however, in depression, interest, pleasure are decreased, and you have a time, it's more than 2 weeks you've been experiencing these feelings. That's when we get into the diagnosis of depression. If you're experiencing grief, your self-esteem is usually maintained, but in depression, feelings of worthlessness and self-loathing are common. When you're experiencing grief, the thought of death may surface when thinking of or fantasizing about joining the deceased loved one. But when you're depressed, the thoughts are focused on ending one's life and not really like fantasizing about going to be with the other person. Depression itself can impact everyone, and we live in a world where depression sometimes is inevitable. We all feel depressed about something. Several factors can play a role in depression. We're going to look at it from a biochemical perspective. You have different chemicals in the brain, the neurotransmitters. For all of the nursing students on the line and the professionals, the chemicals in the brain may contribute to the symptoms of depression. Genetics, depression runs in families. So we say that it has a familial means family. There's something in your DNA. For example, if one identical twin have depression, the other one has a 70% chance of having the illness sometimes at some point in their life. The other factor is personality. So folks with low self-esteem, who are easily overwhelmed by stress and who are generally pessimistic, appear to be more likely to experience depression. So, and I also tell folks that if you have a crisis in your life, like someone dies, or for a nursing student, I always share my story. When I was at FIU, I failed 2 classes in 1 semester because I had an abnormal pap smear that was a class 4. So, class 4s, I had no idea, but they told me that was bad. So I started wigging out. I started freaking out. I didn't study. I failed. I think it was I have to look at my transcript, but every once in a while I'll glean my transcript just so I can tell students, listen, I've been there, done that. So when I got this information, I got depressed, I got anxious, I got sad, I couldn't study, failed 2 classes. Guess what? The folks in the lab mixed my test or did the test. When they repeated the test and they did something called a colposcopy, everything was good. So I went back from a 10 right all the way back down to a 2, got myself together and went back to school, did my classes, got out successful, and I was good. So from that point, I knew that I had pretty good coping skills. If you can cope and you can weather the storm with a lot of these problems that we're having, chances are when issues present themselves in the future, you'll be able to grasp what's going on, understand what's going on, and move with the wave. Environmental factors. Now, continuous exposure to violence for children. We want to make sure we always ask children, because remember, what you see as a child can impact you significantly as you move through the lifespan. People who have been neglected, people who have been abused, poverty, a lot of these social and environmental factors can make some people more vulnerable to depression. So we've gone over, talked a little bit and a little fast about depression, We talked a little bit about grief and how that's a little different from depression. And now I'm going to move into how do you, if you feel depressed or you feel sad, how do you get treatment? Well, I'll tell you one thing. We as a culture, I always speak of my culture from the Caribbean, and I have a lot of Hispanic friends, and a lot of friends from Haiti, a lot of friends from other Caribbean islands. We don't talk about mental illness. You shut your mouth, you just keep it moving, you don't address it. You don't talk about it. My brother suffers from a little bit of schizophrenia. He had it when he was in his teens. We called him special. We just, before my family knew what was going on with him, he was just lazy. He didn't want to find work. He never did anything. He didn't go to school. And so that's how we handle things in where I come from, my neck of the woods. You get off your butt, you go do what you got to do because you're lazy. Now, we can put a name to a face. It is not laziness. It is not people just want to mooch off of others. There's something called depression. There's something called anxiety. There's something called bipolar. There's something called schizophrenia. Whatever it is, you can put a name to it. You can put a face to it. You go to the professionals, you get an evaluation, and they say, okay, guess what? I've looked you up in the DSM-5. That's our Bible that we use to diagnose you. And we say, guess what? Seems to me like you fit the criteria, you fit the mold for a diagnosis of depression. And depression is among the most treatable of the mental disorders. Between 80 to 90% of the people with depression eventually respond well to treatment. And before diagnosing or treating, a health professional should conduct a thorough diagnostic evaluation, including an interview and a physical exam. In some cases, you might want to do some blood work. Remember, I told you about ruling out vitamin deficiencies, ruling out thyroid issues, and explore family histories and what was done, some cultural and environmental factors. And the goal is at arriving at the diagnosis and a plan, of course, for your care. Now, let me first address medication. The course of treatment not always is medication, but I'm gonna do medication first. Brain chemistry, the chemistry in your brain with these neurotransmitters may contribute to an individual's depression and may factor into their treatment. For this reason, antidepressants might be prescribed to help modify one's brain chemistry, and these medicines are not sedatives or uppers or tranquilizers. They're not habit forming, and generally antidepressant medications have no stimulating effect on people who are not experiencing depression. So if you're depressed, it'll help you. If you're not depressed, they're not going to help. Antidepressants may produce some improvement within the first couple of weeks, the newer ones, but the old antidepressants, we tell folks as providers, usually take about 4 to 6 weeks to work. So people will look at you cross-eyed as you're sitting across the desk. You say to them, 6 weeks? Really? You think I will have to wait 6 weeks? I want something now. Well, that's where education comes in. It's not a quick fix. You got to give it some time, because remember, you have an issue with the neurotransmitters in your brain. And what you need now is to take the medication to help bring those neurotransmitters back into sync. Doesn't take overnight. A lot of them will work, I would say, anywhere from 4 to 6 weeks, with the full action potential being 6 weeks. So, just tell them and just gently ease into it. Some people, you got to tell them, listen, and stay with them. I usually tell folks, if you stay with me, you'll see a difference. Psychiatrists usually and nurse practitioners usually recommend continuing to take the medication for 6 or more months. Yes, 6 months until the symptoms improve. Now, you may have periods where you may feel the medication is not working. And that is why we say to you, when you go to a provider, I always educate my patients. And as providers, all the faculty on the call that are psych nurse practitioners or working in the field, we start low and go slow. Start low and go slow. It's like a rhyme. The reason we do that is because if we have a medication, let's say Lexapro is at 10 milligrams a day. And I think the maximum is 30 milligrams per day. I won't start you at 30 milligrams because if I start you at 30, I don't have nowhere to go. All I'll say to you is that, look, I got to start you on something else. So you want to do that. You don't want to be the provider that keeps changing person's medications. You can start it. If it's an elderly person, I say cut that medicine in half, give her 5 milligrams, and then in a week or so, bump it up to 10 milligrams. Start low and go slow, and let them stay on the medicine. You might have to change it based on the symptomatology or the symptoms that they're telling you about. But guess what? If you have to change it, that's okay. That's good. You can change it to something else. But if they're feeling better and they're doing better on the medication that you prescribe, you just keep them with that medication. The next modality of treatment is psychotherapy. Now, let me tell you, folks don't want to go talk to anybody. Oh, I don't want to go talk to no shrink. I don't want to talk to no therapist. What's the therapist going to tell me? They'll tell you a whole lot about yourself. That I know, been to therapy, been there, done that. There are things that we cannot handle ourselves as professionals. So we got to go sit the other side of the table. There's nothing wrong with that. Talk therapy is sometimes used alone for treatment of mild depression or moderate to severe depression. So we say medicine alone sometimes don't help. Let's say you were in a marriage for, let's say 30 years. You were married to somebody for 30 years, and all of a sudden, one day, he jumps up, midlife crisis, decides he's going to go get the little red Corvette and a young girl. And you there like, what? Your whole life has fallen apart because you and this person have formed a bond for 30 years, and you just crashed. Let's not say you burned, but you just crashed. Guess what? A therapist is what you need. You might need the psychiatric nurse practitioner or the psychiatrist to help you, but you're going to need to talk to somebody. 30 years is not 30 days, not 30 seconds, not 30 minutes. So talk therapy is very important. There are several modalities in terms of psychotherapy that I'm not going to really get into because we're at the 12:24 mark, but cognitive behavioral therapy has been found to be effective in treating depression. Cognition, what you think, changes your behavior, how you act, and that combination seems to be effective in treating depression. Cognitive behavioral therapy helps a person to recognize distorted negative thoughts and the goal of changing thoughts and behaviors to respond to challenges. So psychotherapy and medication. Also, self-help and coping groups may also be an effective means for you to get some help. So we're moving on to the second part. I know I talk along, but it's an hour, so we're good. Keep the recording going. How do we become happier? So I'll tell you a couple things you need to do to become happier. You want to manage your stress level. If you have a lot of stress in your life, find ways to reduce it. Such ways as time management. I know as students, you got to manage work, you got to manage life, you got to manage being a wife, you got to manage being a girlfriend, you got to manage being a mother, all these things. Kids are at home now. You had no clue about Zoom. So look, make a timetable for yourself. One of the things you can do is introduce regular exercise. I know sometimes it's hard, but everything's on Zoom now. So just go to YouTube, pull up some exercises, pull up some music, and dance yourself away. And these are positive changes that can help you control what's going on in your life. If you have feeling of anxiety along with the stress, like me talking fast, breathe in. Okay, Heather, take a breath. Oh, what's that? Oh, let's take a breath. Breathing exercises always help. The next thing you can do is to bring some joy in your life by enjoying yourself. Doing things that you enjoy is good for your emotional well-being. Simple activities like watching sports with a friend, taking a soak in the tub, meeting up with a friend for coffee. These are all things that can improve your day. Simple things. You don't have to spend a lot of money. Call up somebody and say, hey, tomorrow morning, let's meet up at Starbucks and let's log on and do some work. Let's have a coffee, a Java, while you do whatever it is you do. Do something that you're good at, such as cooking, or like me, I like to sing. I like to do karaoke. I carry my own tune, and I get very upset with people that tell me that, oh, no, they don't tell me I don't sound good because they know I'll have a cow. But I like to dance and I like to sing and I do it all the time. Even sometimes if I'm in the Walmart or any place where I hear music, my feet start to go and I look around and tell people, listen, I'm on this side of the dirt. So if I'm on this side of the dirt, I'm excited to be, look at me like, is this lady crazy? Yes, I am. Any morning you wake up, people, and you're on the side of the dirt, the other side of the dirt, you're good. Enjoy yourself and find someone to enjoy things with. Try to avoid things that seem enjoyable at the time, but make you feel worse after you do them, such as drinking too much alcohol or eating junk food. Don't do that. It might seem good. Oh my God, those Oreos look so good. And then after you eat them, you feel bad because you got to take yourself to the gym. Are you serious? You just melted 25 pounds in COVID and you go to the Oreos. You're going to feel bad. Don't do that. Just remember things that make you feel good all the time. Boost your self-esteem. Self-esteem is the way you feel about yourself. The best way to improve your self-esteem is to treat yourself as you treat a valued friend in a positive and honest way. Notice when you're putting yourself down, such as thinking you're so stupid or nothing is going good, you're not passing your class, all of those negative self-talk things. No, you wouldn't say that to a friend, would you? You would tell your friend, look, you need to get off that pot, straighten up, and fly right, because I know you can pass this class. Do not call me and tell me, oh, I'm failing. No, you don't feel good about this, or the teacher's this. Always got to blame it on the professors. I tell them, yeah, blame it on the boogie. Blame it on somebody else. No, you get up, you feel good about yourself. Whatever you do, tell yourself something positive every day. You are bright. I make sure I tell my students, look, you guys are bright. You would not be sitting in the seat that you're sitting in online or at home if you were not bright. You did what you need to get into Miami-Dade College, and guess what? You're going to stay there with that super glue in that seat until you get out of that program, the Benjamin León School of Nursing. You got this. This is what you have to tell yourself every day. Guess what? I'm smiling with you because I did that when I went through my PhD program, and I did not move from Barry University until I got my piece of paper. There you go. Have a lifestyle that's healthy. Limit your intake of alcohol. When times are hard, it's tempting to drink because drinking numbs the pain. But that's not what you do. But it can aggravate some feelings. It can exaggerate some feelings and make you feel angry or aggressive. It can also make you feel more depressed. So you don't want to go to drinking or you don't want to do drugs. Choose a well-balanced diet. Making healthy choices about your diet can make you feel emotionally stronger. You're doing something positive for yourself, which lifts your self-esteem and lifts your spirit. I call it making your spirit happy. We talked about exercising, sleeping better. Look, I'm old and I don't sleep. I have what's called chronic insomnia. There's nothing in the world that they've been giving me. Everybody's soursop tree leaf, everybody's Cersei bush. Everybody has a remedy for my insomnia, except guess what? My medical doctor. And if I don't take my medicine at night every day as prescribed, I don't sleep at night and my day is miserable. So guess what? I follow instructions. Yes, I do. 10 o'clock, I take my medicine, I say goodnight, and I get up in the morning, I feel good. If you have chronic insomnia, please get some help, because if you don't sleep at night, that will negatively impact how you're feeling during the day, and you can't rejoice and wiggling like I am here in my seat at the North Campus. 7 to 8 hours at night, you get up in the morning, you feel refreshed, and you're good to go. Another thing you can do is journal. Write your thoughts down. Write in a to-do list or something the day before to help you better organize your day, make your thoughts clearer, your mind. It helps you keep from being distracted. You can journal, do journaling, or make a to-do list every night before you go to bed as to what you're going to do the next day. And make sure some of these things are included in that to-do list. There are 24 hours in a day. You sleep 8. Got a whole bunch of hours left. Make sure you do something for yourself, even if it is 1 hour a day. Take time to share. Communication is very important, whether it's with a friend, a family member, your therapist, a counselor, your church, or your pastor. These are the important people in your lives. Find one. You don't want to talk to everybody. Trust me. Because some of these folks will, no, we know what they do with your business. Put it on Front Street. No, you don't want that. Talk to somebody. Find somebody that you can talk to and confiding, and somebody that's going to call you and check on you. These are troubling times, and you need to make it through this program. Have somebody call you and check on you at least once a week. Girl, how are you doing in psych? How are you doing in that class? Dr. Kimsey or Dr. Mari, tell me what they're doing to you. Oh, well, there's keys are tough, but guess what? They have to be tough. They got your back. They want you to be successful. Call somebody and vent, and make sure that that person tells you. Don't make sure they don't tell you stuff you want to hear. Sometimes they're going to be tough. Sometimes I get some calls and I lay it on real thick. Well, I love you. And if you call me, I'm going to continue to love you with what I tell you. Taking steps to help you release tension rather than keeping things inside. It helps strengthen relationships, connect with your children, connect with your husband, connect with your instructors, connect with friends. That's what you need to do to be happy. There's benefits from talking. There's benefits from counseling. The college has programs in place to help you with therapy if you need it. There are things in place for you. And build your resilience, guys. Resilience is what allows you to cope with life's ups and downs. Making something worthwhile out of painful times helps your resilience grow. There are support groups to help others, or making something creative out of a bad experience by, for example, writing, painting, singing can help you express pain and grief and whatever you're going through. These are things that can help you to feel happy, or let's say happier. And this brings me, it's 12:35 right now. I went a little bit over. I tried to speed up the conversation, but I have my phone. I'm going back and forth, but let me put it right here. We are in the question and answer section. So I'm going to open it up right now for the participants online to ask many questions.